And interestingly, earlier on, children were thought to be super spreaders, and the recent information is disputing that. It is actually thought that children acquire infection largely from adult exposure and not child transmission. And I think right now there's been a significant proportion of adults who have been vaccinated, and suffice to say that maybe the risk to the children has been greatly reduced at this time. So we fail to see the justification for mass mandatory vaccination in this age group, and also in light of side effects that are largely unknown. Guidelines from WHO are usually based on evidence, that is, research is undertaken, conclusions made from that research, and then seen how to be implemented into policy or clinical practice. I think that was one of the issues that came out with the WHO treaty as we responded to the treaty itself, that similar to other disease conditions, there's limited research that has been done in the sub-Saharan African region concerning COVID, our epidemiology, our responses immunologically, even natural immunity, so to speak. And so the notion that data can be extrapolated or used from other populations, I think is a misnomer, because even given the data that we saw previously in the pandemic, we saw that sub-Saharan Africa had the least mortality rates or infectious rates, and that despite our limited resources, our not together very up and running health systems. So there are still gaps that haven't been addressed, and I think that contextual data would be necessary in order to inform those guidelines.